That's all you need.
All right,
Okay, everybody, we're recording
okay,
our regular meeting, Health and Human Services Commission, and first time you speak, please state your name. Start going, all right, approval of minutes. That's at number 7.
Commissioner Marks does make a motion to approve the minutes and also to thank our
thank you.
professional note taker who does a great job.
I think there was more in the minutes than in the meeting. Is that good? Thank you.
All right, all in favor?
Aye.
All right, approved, as written.
Thank you, Louis.
Of course. All right, we're gonna go on to reports, Health Department.
Jen Allison, Director of Health. So first, I wanna start off, I forgot to add it in here, but, OpenGov that I've been co-project manager of for the last 5.5 months. We're going to launch November 1st, so we're excited about that. And that's for all the various different health permits, you know, restaurants, salon, wells, septic, whatever, pools. And then, building department, planning and zoning, wetlands and engineering. And I also built under my module for Bethany, the human services, donation, link. So electronically, she can accept donations and it'll go to her different accounts split out by what they select, food pantry, you know, energy assistance, whatever, or, and I even added others so they can write in if they have a special. Yeah. Yeah. No, these all go to our Munis accounts, just to be clear.
Awesome, thank you.
So we're in the testing phase now of every single one of our permits. So you'll be seeing from the selectman's office, communications, go out towards the end of the month to the various outlets, but, we're excited to finally, you know, leap into the 90s here and get some kind of online permitting and credit card use. And, the health department, it's the perfect time for us, because that's when we begin restaurant relicensing. That has to be done by December 31st, so we're kind of the guinea pigs right out of the gate with a pretty big thing. So we're gonna be emailing, communicating with our restaurants before the launch to tell them how, you know, this works. And then, of course, if they have any issues, you know, one of our staff members will walk them through it. So that's,
Does each, unless you're a commissioner, do they have, an annual renewal or is it every other year? How frequently do you have to get a permit to be a?
for restaurants, they're renewed every single year.
Every year.
Every year, and then by state statute, the tax collector and tax assessor have to sign off before I can issue the permit. So that also has been built into OpenGov, and with Sebastian, our assessor, and Rosanna, our town clerk, they'll be getting training, and they've also been participating in the test methods.
Great.
Bless you.
Couple of questions on that. How many places do we inspect? How many restaurants or eateries are there in town? And in the past, what's the fail rate or this problem rate that?
Well, there's no failing anymore. In February, they adopted the FDA food code.
Okay,
So there was, before there was, you know, a pass or fail score, you know, you can have a 90, but, you know, 1 4-point violation is considered a failure. So, and we observed an employee not washing their hands and then, you know, cross-contaminating food. But now it's done by Priority Foundation, Core Foundation, and then Gino has to go back depending on what the violation was. So if it was a more important violation, you have to go back within 24 hours, then there's 72 hours, then there's 5 days. So adopting the FDA code has now made it so you're in there even more than before. And there's 97 licensed food service establishments. And then it depends on their classification, the number of times a year that they're done. A class 4, like a sushi restaurant, like Hashi Sushi, they're done a minimum of 4 times a year. But that 4 times does not include all these having to keep going back for all the little things. And then like a class 1 would just be your mobile, that just has, you know, prepackaged stuff in their store.
West Barstow Commissioner, is this ever, made public? At all, the number or frequency of visits or any type of citations for the restaurants?
Well, Mike Diamond has, and everybody has access to all our food inspections. So, you know, Mike used to, like in his earlier days, go through it a lot and go through it, but now that there's no failing score, it's, you know, a harder narrative to create for the media. But all our inspection reports are scanned the day of inspection, they're all listed and posted on Docs on Demand, so anybody can view them at any time, it's all public record. So, yeah, so look for communications about, OpenGov, and then we'll also be obviously emailing all our individual contractors.
Do you think this is for economic Commissioner, do you think it's gonna make things easier for you, or?
Well, our main point is for the financial part of it, because right now we can only take paper check, which is beyond archaic. And then you have to scan it through a check machine, put in the accounts, then finance has to take that, and then you have to wait for finance to post it to the account. So nothing's like happening in real time. And like the building department gets my part of my building review fee, and that's been a mess for years, because we don't get any log from them of what's been paid, when it's been paid, we have no way to look it up. So I have my spreadsheets of permits that I reviewed, the permit number, address, but I can't reconcile that payment. And that's been a problem for me for 10 years. All my other stuff, we handle our money directly, can reconcile the check number, blah, blah. This will go directly into our Munis financial system, and anybody can pull the report internally at any time of what the revenue is, what the account, what was paid, and the amount. So, it will be great for the auditors and the finance department, because it removes a lot of that manual stuff. So vaccine update, as I mentioned at the last meeting, it's private market, so we're not doing the adults over 18 for COVID. It's, we did get quotes, you know, the lowest we got was 129 a dose. You do the math of, you know, the 4,000 we did last year, you're talking almost $700,000. And, you know, and then we have no way of billing, and even if you had a way of billing, a lot of, the insurance companies are being difficult about this. And so no health department in Region 1 at this point is even wading into those waters until it settles down. Nobody's gonna put up that kind of money and then lose that kind of money. I mean, that's more than my entire budget. So we did order the COVID for under 18 from 6 months to 18. We have Moderna in all age groups in that span. That's free from the state through the Connecticut Vaccine Program and the Vaccines for Children program. We also got, Pfizer came in, the only one we're missing from Pfizer is the baby Pfizer, the 6 months to 5, but that's on its way for next week. So we literally just got that last week, it just began, people over right now in our house. We have talked with the pediatricians in town and said they can refer anyone to us. Because, you know, again, nobody wants to put out to spend money, you know. Now, RSV for children, it's an immunization, just to be clear, not a vaccination, will be, here probably next week. So that again, we have a list of parents that have already contacted us. We're gonna circle back and we'll let the pediatricians offices know when it actually arrives, to be able to be doing that too.
Jen, on COVID stuff, is there, or what is the CDC recommendation, or what is your interpretation of the mix of recommendations for what normal folks should be doing this new set of boosters?
Well, the new one, they strongly recommend the 65 and over, those immune compromised, and those that are younger, because just like anything else, they're the ones with, you know, the weaker immune system. I mean, there hasn't been much of a demand for it, I mean, which you kind of saw, which is why most health departments are not going to be ordering it, because it's too much of a gamble. But there's a bridge program that the federal government has with the pharmacies. So if you don't have insurance, you know, especially in the cities and you want the vaccine, they can still go to the pharmacy, and under the bridge program, they would be covered. Those that are insured and your insurance just doesn't cover the administration fee, there is nothing for that. So,
But just to be clear, it sounds like a strong reco or, compromise and older absolutely do it. Other than that, it's discretion, a good idea, but
Yeah.
they're not pounding their fist on the table.
Well, the CDC has come out, from the information that we have, is that is still recommended in order to remain up to date on your COVID vaccines, that you have this new. And it is available through all the pharmacies that are here. Through Medicare beneficiaries, it would fall under a Medicare Part B. RSV falls under a Part D, which is a little bit different. And we're, Wave, I'm just speaking as Wave, we're ordering all three and administering it to our population. So some of it is billable, some of it we eat. But it's, we want to make sure it does decrease hospitalization rates for those over 65 for sure.
Question. They've been advertising on TV, taking the COVID and the flu shot at the same time. I'm aware of a 60-year-old and a 65-year-old that got terrific response or bad response from doing that. And I was wondering,
the
what do you,
CDC has said that all along. Our nurses don't recommend that and recommend, in talking with Dr. Reed and Dr. Pierce,
yeah,
at least a 2-week.
Doctors, the other
Window?
doctors I've heard don't recommend it.
Well, the
Right.
CDC came out and said you can do it at the same time. We have not, we will not risk that.
Yeah, and no one around here is. But again,
But we've always, I put Health and Human Services in that, and the local providers have always been a little bit ahead of the CDC. I think, in actually seeing what our patients are responding to, and I think the CDC will start saying that maybe that's not the right move to make. It's easy to make the recommendation, but when you actually put it into practice, sometimes you get different results.
good.
and then obviously we also still, have the flu, we have numerous clinics scheduled for that in October. Case updates, as we've been saying, DPH, removed the town level data. So I have no way of getting the Canaan town level data. So we can only get the overarching data for Connecticut. So I included, some of those graphs for you, just so you see, including the hospitalizations and deaths. Because the case numbers haven't really meant anything in a long time with the home testing. But hospitalizations is something you can always, stick to. And I also included the chart that shows, COVID, flu, and RSV, showing all three at once over the seasons. Environmental updates, everything's just going, the same. As I said, we're about to do relicensing for the restaurants, which is a big undertaking for us. We did have 2 additional mosquitoes trapped by the Connecticut Agricultural Experiment Station for West Nile virus. We have 2 stations in New Canaan, one on Michigan Road, one at Wood Swamp. But still no human cases, so that's a good thing, but it's just a reminder of, with all this wet weather and dampness, to keep mindful of mosquito-borne diseases and protection. We just had a regional meeting on Monday for the Public Health Preparedness Group. The state also started doing monthly sessions, training and doing overview of the 15 capabilities that public health is responsible for. I include that chart of what our areas are. Russ Kimes is working on the local plan of, his overarching stuff, but these are what we're responsible for federally, legally, so these are the areas that the health department focuses on, and that's what the grant covers to do the deliverables. Immunization grant, everything's been submitted in the court. I'm just still waiting for the Attorney General to actually process the contract. So we can start getting the money on that, because the ELC two is just running out, and that grant is to cover, again, the nurses. That will go through to June of 2024. In there, it's mandated and allocated of that 17,287 for media communications that I have to do an RFP for, but I can't do the RFP without the language of the contract. So it's kind of in this chicken and the egg thing, and 17,000 to me seems pretty excessive for media. There's nothing I can do, it's the way the grant is, and that's what it has to be. I would rather use it on something else, but I can't. I'm kind of stuck. I'm stuck to their thing. Workforce Development Grant. I just got an email yesterday from the state, my, project was approved and to enter the budget into core CT. By today, I did. That's how, expect you like that to do it. So I did enter the budget into core CT. That's for $45,030. That is an upfront lump sum payment. So unlike the other grants where you're doing reimbursement, submitting all the financial reports, this is an upfront one where you're doing the financial reports on the back end. Everything's done through core CT, which is the state comptroller database. And in that, I copy our CFO and town treasurer and the people at the state that need to review it and approve it. So that's the nice part about it. It is all computerized instead of the old school days of Excel spreadsheets. In that grant, that runs till 2026, but I will start picking it up July 1 of 2024, right as the immunization grant runs out. And that will run to June 30th of 2025. So I have another full year that my nurses are covered. So this budget year, again, I won't be having to ask for anything for that. It's covered for the nurses. So that's good that we can keep that going. Shannon and Ellen have been doing weekly of the blood sugar screenings for diabetes at Lapham on Wednesday. Fridays, they do a health topic and coffee time with the health department. They pick a different topic every week. People sign up and register and they go, and that's been going really well. And then they can ask anything they want. They're supposed to play, brain games after, but it ends up usually being, just questions and talking, which is great because we like that. The skin cancer training, free skin cancer screening, that's already finalized for October 23rd. It'll be at Irwin Park. We're kind of building up an area like we used to do with vaccines for privacy purposes for them to, obviously be totally private when they get screened. She can do 25 people with the free screening. Aggie's gonna be sending it out Friday in her newsletter. So we're pretty excited about that. And then the QPR trainings, we have 2 scheduled for next month at the New Canaan Library. And just going over some of the charts that we have in here, you see the suicidal ideations a little up for September after, kind of quiet July and August. And then I did also include in there the maps of the mosquito activity, so you can see how it's picking up. Tripoli, mostly in northeastern part of the state, not really down this way yet, but every week it's more and more being added to the map. So where your repellent is. And that's about it.
Wow.
Great report.
Good things happening.
Yeah.
So I'm Bethany Zara, Director of Human Services, and this is my report for the month. Kids in Crisis update. Believe that they solidified a Kids in Crisis counselor for the high school, which had been missing. So we're hoping that that has taken place and that person will start this month. The other issue is Board of Ed is going to pay the SACS Kids in Crisis Teen Talk Counselor this year. But I'm working with Brian, let's see, the following year, to see if the Board of Ed can continue their support for
Who's
counseling.
paying for the high school?
We are.
Yeah.
Human Services, we split it. Ridgefield does the same thing. They are actually, I believe, trying out this year, somebody in the elementary schools. Which is interesting.
How long has the high school position been, vacant?
Since the
Started.
fall, since the school started, there has not been somebody
Is
there.
there any coverage or interim coverage or anything, or they just?
So they, the teen talk counselor at the middle school, although it's a different species, at the same time, it also includes the 24/7 kids in crisis safety house. So if someone is in a crisis, it still covers what we're going to be needing for this safety. Yeah, Alicia?
Stephanie, yeah, I would just have a question. I know historically, we have paid for the teen talk counselor at the high school because of a concern that the school know the information that the teen talk counselor gets. If they're paying for is that still an issue? And going forward, what is the best plan for funding this?
Yeah, so, the way it's structured, and I'm talking, I would have to confirm this, but it's not, what happens is we can pay for the salary, parts of, the money that we pay each year goes to the salary of the social worker, as well as the coverage of keeping a 24/7 crisis center available. So it's where the funds go. So when we say they do the teen talk counselor for the middle school, we do the high school, it really is, we make sure that we're paying for the salary of the counselor, so it puts it in our wheelhouse. And so, just to simplify, we split it financially, but when you look at it, we make sure that they're paying for the 24/7 access to help. We're paying for the salary of each counselor, so I think, it differentiates that.
Yeah.
When you say we're paying the salary, my recollection is we only pay roughly half of the total cost of that counseling.
No, we are at payment level of all the schools. We are paying full fare, which we should.
All right,
For years, we were not,
yeah, we
only because we
were on scholarship.
we were on scholarship for years with Kids in Crisis,
Yeah.
because we started it with them and they wanted us to keep it. But then there's a wait list for teen talk counselors now, Kids in Crisis. We don't want to lose that position of having it. And we had to step up to the plate. They needed the funds and we wanted to honor that and continue our.
So is the counselor a town employee as opposed to a school system employee? Is that,
No, it's a Kids in Crisis employee.
okay, so.
And then we supply a grant
Okay.
to Kids in Crisis. They also do private fundraising. Other agencies, organizations in town give to Kids in Crisis.
Community Foundation does.
Community foundations.
So the records, individual records, of private information is not owned by the school system,
Not at
it's
all.
owned by Kids in Crisis.
Kids in Crisis, exactly. And that is.
So I think Alicia's question was whether the school system could directly pay Kids in Crisis and get us out of the equation.
They do. They do directly pay, and it covers services other than the teen talk counselor at in the school and library.
Tom sort of picked up on what I was saying, which is I'm curious if going forward, if there are privacy laws in place already, is it just a perception issue by the kids? They don't want to go see someone if they think they're employed by the school board, or should we get out of the business of funding Teen Talk and that should just be a permanent line item on the school's budget?
But this is where the Board of Ed comes in, and I don't want to be speaking for them, but it's the Kids in Crisis. It's their notes and documentation. And whatever their privacy legal department has it set up as. But that's why we're keeping the expenses of who's paying for what. And that's all done through Kids in Crisis, and I'm not sure the structuring, but it keeps their confidentiality clause, however they have it structured, it keeps that intact. So
Okay.
I don't know if the school is signing away, but as long as they're not an employee and paying, then that does not, that keeps their rights of having their documentation. So it's really a basic separate.
Is that
concept.
something we can reach out to the Board of Ed and just get clarification on? Because I think that's an important issue from a HIPAA standpoint, that it is separated. Maybe the schools can receive data that, you know, we took care of this many kids and these are the issues. But I think from a privacy standpoint, I think that needs to remain with the Kids in Crisis and.
Yeah, and it
council,
does.
right?
Yeah, but I'll, let me look at the information in terms of
Yes,
where,
historically, that was the single reason why Kids in Crisis
Exactly.
existed in high school, was that the kid could go in with full knowledge that this was not going outside the room.
and a parent could as well, if it's kid related, but yeah,
Right.
parents concerned, don't go in there, don't, this and that. It created a freedom of conversation for somebody needing help, privately.
Good.
Thank you.
Sure, absolutely.
Great question.
I hope I answered it okay, and I might backtrack a little, but this is how it was structured. I just want to confirm, and I'll do that at the next meeting. Walter Stewart's and the Chamber and William Pitt delivered $9,000 worth of non-perishables to the pantry. And this was from the New Canaan Stroll in August, so it's fantastic. I mean, yeah.
Is it cereal though? Cause I was there and there's so much cereal. Give away, I'm just kidding.
Yeah,
Yeah, it's like, yeah, they got
the cereal's expensive.
I, you know, there was a lot of in there.
Or air.
So it's just that,
No, it's all, it's amazing.
it's that continued support throughout the community, that's incredible.
I would make a motion that we have, and Harrison can sign it, or the commission can sign it, that we send thank you letters or some kind of.
Yeah, I will forward what I did send out, on receiving it. But if the
Just.
commission would like to write something too. I have the-
Yeah. Great idea.
It'll be
I can
fast.
draw something. too.
Yeah, I just think that, when corporations like that step up
It's
and help
incredible.
support, it's incredible, but it also, some recognition from the entire commission, I think is
Great.
warranted.
Okay,
Well,
and
particularly nurturing the Walter Stewart relationship, because they give
You're very
Continue
generous.
the money all throughout the year, so we want to keep that fresh.
So the New Canaan Stroll, were they raising money during it, or was that, did people pay a fee maybe to participate? I'm just wondering how the money came out.
you could donate at Walter Stewart's.
Oh, okay.
You could donate, at the event itself.
Okay,
And so that $9,000 worth, that was of retail. So I think they took in $5,700 and we got the retail,
price,
the wholesale price,
right.
which on the shelves, it was $9,000 worth.
Okay.
So we're,
Did you take those pictures? That'd be a good thing.
it was in the somewhere it was put in,
That's great.
the town put it in and
That's great.
Chamber of Commerce put it in their letter, so. Working with finance and Westmount Management, which is the management company that runs the affordable and low income housing. We're trying to get a direct deposit set up instead of doing the archaic check system of issuing a check through finance. That's going very well, and it's a much easier process. And puts us up to the 21st century, as Jeff says. The bereavement group at bereavement group at Lapham Center, not enough people signed up to have a healthy type of group discussion. You need to have more than 3 people. So Marcy's reached out to each one, individual counseling, and finding them resources, but what Marcy and I are doing, we've talked about being in the right environment for someone. And this is where, Marcy and I are partnering with Waveney Visiting Nurses because they hold a number of bereavement groups. They're interested in having one during the day in New Canaan. And so Marcy and I are going to, we're going to our training this month to become bereavement counselor volunteers, through Waveney. So, thank you, it's great.
Good job, Rob.
It's great, and so anybody can go to the bereavement group, you don't have to live in New Canaan, and we'll find a place for it, I don't know, Waveney Care or one of their buildings, one of their offices can accommodate. So that way we're putting ourselves in the situation where there is loss and bereavement going on a daily basis, and maybe we'll see if that works, we'll see. So we're gonna do that. Staying Put had a library event October 4th, which was last night for the panelists. There was a discussion for resources to aging successfully. I was on it last night with 3 other people, Gina Blum from Staying Put, and a senior concierge counselor and a real estate broker. And it was very good. 100 people were there.
Fantastic.
It was fantastic. It was absolutely, every seat was taken.
What was the age profile?
Age profile, the spectrum was from adult child to older adult, and I would say the majority, probably 90%, were 70 and older.
Great.
That would be
That's
nice, that would be
encouraging.
nice.
Yeah,
So that was amazing.
Head Start would be very happy.
Yes,
That was
Yes.
her thing.
very interesting things, that were talked about, and so that was a great
Yeah.
great conversation. September meetings I've had just with, something's happening at the school, a portrait of a graduate at New Canaan High School. And yeah, it was great. And it's a comprehensive guide to a portrait of what our town wants to see, what we envision as a graduate from New Canaan High School. And starting, and then it helps with the curriculum and looking at from K through 12. So last week was the first set of 2 nighttime presentations and talks and sort of roundtabling it. There are like 120 people, there are like 12 tables of 10 people from children, middle schoolers, high schoolers, as well as educational, human services was there, New Canaan Nature Center preschool. I mean, everybody was envisioned in this, and the Board of Ed, it's a nonprofit organization that comes in. We have 2 more meetings, one in October, one in November, and then they will present to us what our portrait for New Canaan of a graduate looks like.
Wow.
So they do this, and they've done this, many other places, but they're in New Canaan doing it, and I think it's fantastic at the Board of Ed. So we will report back, and that will definitely be just for the community of what do we want our graduate to look like?
Now, I assume we have a diversity of graduates, they all go the same.
Right. It's
Active.
very broad, and the questions that are brought up that they ask, and each table of 10 discusses this, puts it on paper, all this information of these roundtable discussions will be given to the facilitator, and to the organization, and they look at it, and they present us with what we have come up with.
Are they talking curriculum or social?
Everything.
Environment.
There are 6 pillars, 6 columns, 5 or 6 columns that they look at in terms of, and then they build strategies around it, that we build strategies around it, or the Board of Ed looking at what this group signifies as a portrait of a graduate that's ready to get out in the world. Resiliency, things like that, defining what was put in words on the table. So we will get a completion of that, which will be interesting to see. We continue to have, New Canaan abuse prevention, which yesterday was the domestic violence awareness proclamation at the high school. Huge, it was a great turnout. It was excellent. Jackie was there.
Melissa and I were there, and we just were so.
Oh, that's.
Yeah,
so the-
yeah, it was fantastic.
I said that last year. Yeah, so it was great, Jackie was excited.
Mhm. It was really excellent.
And, it was, the record, we hold the record, I guess, not that anyone's counting, but ours is always the biggest.
Everybody's fun, right? Dee Dee Bar.
Judy's always, she's just so inspiring, yeah.
So inspiring, so knowledgeable and compassionate.
She asked those kids directly, you know, are you safe? Is somebody reading your emails? I mean, she asked them really specific questions to think about,
Yeah.
yeah, with their partner.
So it was great. We continued the emergency sheltering, Gilda's organization, and you know, getting it introduced to Lower Fairfield. Unbelievable resource, at no cost for those needing assistance. And so gotten them together with Silver Hill as well. They can utilize each other for resources. Parent support group, Buchanan Community Foundation, I've spoken to them, working with the opioid settlement and some of the possibilities where they can use our services, the money being granted, which we will discuss on the agenda. Actually, you know, just the continuing, Behavioral Health Alliance quarterly meeting will be held at the end of this month. And we have new resources, the Parenting Center at St. Joseph's for parenting, positive parenting, tools, relationships, diapers, which is fantastic. Referrals continue. Had 2 very expensive evictions completed. So that Human Services will put the bill on that. And
What's the total number, year to date evictions? Or I recall approximately 6, is that about right?
well, yeah, for fiscal year starting in July, we had 2,
2, okay.
3, but
I meant the calendar year.
calendar year, yeah, 6%.
How expensive are they?
So for these 2 homes, the people left everything. And these were homes in an apartment complex, and one had lived there for 9 years. And,
Are these any of these in our affordable housing? Or these are all, okay,
no. So we have to pay for the storage,
sure.
removing boxes, every single thing. And it's just the town charter, it's in every town, it's
Yeah.
a state, federal charter, so we have to do it. And then the blood pressure clinics and schoolhouse, that's ongoing. Marcy and Jackie's caseloads continue, unfortunately, 7 DV reports this month. And these are reports from the police, these are not private, going straight to domestic violence crisis center. So, there's a lot of time spent with them, getting them into a better spot to continue services that are needed. Fuel energy assistance started up in October, and the number of people that have signed up already has far surpassed what we did last year.
Look, I think there's a couple things. We're seeing evictions go up. I know that we're seeing domestic violence starting to trickle up again. I don't know many of you who are reading utility commission, not our own here in town, but for the state of Connecticut. We're gonna see another major hit in Eversource. So utility costs are gonna go up, maybe combined, maybe 24 cents per kilowatt hour as a cap. I mean, that is significant for the transfers and utilization, especially for people that are on fixed income.
And this is the first season that Canaan Parish Affordable Housing, which is 40 units of affordable housing, 60 units of low-income housing. Most of them that will qualify for energy assistance. So we're working with them.
And the last is, we're looking at 2024 cost of insurance, medical insurance, and we're looking at a 17 to 25% increase. I know a lot of the employers are going to be pushing that cost down to their employees to be insured. So you're going to see people that are going to be opting out of insurance. So just from what I'm seeing, for those, vulnerable populations, for those income restricted population. Those are 4 major waves that are getting ready to
Yeah.
hit them in 2024, and I just think that,
And-
as a commission, we should be
Yeah,
aware of that.
so what we can do at Human Services, if someone comes in, we can't get started paying medical bills. It's a very slippery slope, but what we can do is we can pay a rent. An energy bill, there are things that we can easily pay to offset the cost so that they can pay their medical bill. You know, we call Medicare, we urge them, please, before you do a medical service, make sure you're at the correct provider.
Right.
I'm just seeing a tsunami for demand for our
Oh,
services
yeah.
next year, it's getting ready to.
Yeah.
To.
And it's festering, so we are there, we're ready, we have money in the coffers, and, this community is incredible. If we need to do an outreach, we will, now that we have.
So we said, yeah.
Yeah. Pay online, donate online. You can see from our food pantry, September, we had an uptick compared to July and August. 99,
That's to Russ's point.
yeah, total household individuals utilizing the food pantry. August, we had 66 shoppers visiting for their family individuals, and September we had 81.
Yeah.
So people are starting to see where they can save, and food pantry is one of the first things they go to. They also, most likely, the people that are here also qualify for SNAP, the food stamps, as well as they go to person once a month. They have access to that food pantry, Lower Fairfield County Food Pantry, and they are being utilized. There are upticks in those food pantries as well. The New Canaan Urgent Assessment Program, these are the numbers that came in this month. We had 7 urgent assessment done for New Canaan cases and 4 Weston urgent assessment. So a total of 11 cases for the month. There were no other outside communities taking advantage of the system. It's really stayed within New Canaan and Weston. And you can see the age ranges really are staying in the young adult, adolescent, and child area. And the referrals were from primary care, Town of New Canaan, which is Human Services, or any other entity that wishes. It includes all departments, but it's really New Canaan Human Services and the New Canaan school system.
Anthony, wasn't there another town that was going to do this?
Weston,
Weston was it?
at this point.
Okay, so we have a new person that's been coming in to Wilton, right, next year?
Yes.
So, maybe that's an opportunity.
Yeah,
And for Dariene's got a new first select person too. And Darien was one of the ones originally we were trying to get, because obviously they had quite a crisis, last year, so.
yeah. So we are,
Those are 2 opportunities if there's capacity.
Would you change the leadership there? I think you may have a.
right, and the social service, the human service departments directors there.
Yeah, Ally really
They-
does.
yeah, and they love this,
Very.
so there's still going to be a push for
Yeah,
it.
they're
It's
not
not-
the ones that held it back.
Right.
Right.
Exactly.
You forgot the most important change of management, New Canaan.
Just funding, just
We
funding.
should.
Yeah, but we're already in,
We're not,
we're already in.
we're not in question.
Silver Hill was able to decrease
Right.
the cost.
Well, I was gonna suggest actually ensure that the new field selectman attends one of our meetings to get the flavor of what this group is all about, and
Yeah.
that we have some credibility.
She will.
Bounce on it.
Girls. That is my report.
Silver Hill took that.
So Silver Hill Regions,
Prices.
yeah, they were able to take the price down after a year with those initial startup costs. So they've been able to take it down. Susanna Lewis, who's Silver Hill's Community Outreach Director, they were able to lower it It was originally 250,000, they streamlined it and it's somewhere quote unquote between 200, 225. So that, the savings has gone over to helping, maintain the program at the quality it's at, but still it would be nice.
Well, I know the New Canaan Community Foundation, there are other nonprofits, I think, that are out there looking to help.
Help, right, and, this was Silver Hill's way of helping with the process as well as they have, their own funds for giving civically as well, so we'll. Peter, are you on that? Are you?
I mean, I know the foundation's, about $50,000 grant.
Huge, yeah.
Yeah, you had a couple of 100,000 though in dry capital, don't you?
But that's for everything. There's, there's, I mean, as I always say on that commission, there's a lot of needs beyond the really urgent care. And I think this is amazing, but the lower acuity issues don't have, this kind of program, and other towns do. Doing some things that are interesting, and so we're pressing on that. But candidly, I'm focusing on more preemptive stuff, training, and so people have resources can learn before they actually get into the pipeline, like healthy living, healthy relationships, something like that, so. It's amazing that the further up the funnel is where we're starting to talk more about it.
And we're hoping that you start seeing hospitalizations and things of that nature originating out of here, we start seeing that in suicidal ideation start going down. Like you said, we preemptive address it and then identify it early on and help with treatment and programs.
All right, so moving on to old business, executive stress, Paris had requested managing your success addiction. He wanted to know if this is something we're gonna continue working on, where we're at.
So for me, we're gonna continue, I'm hoping to work with the commission to do it, but I did meet with Andrew Gerber and some other people in town. It came a question of timing and bandwidth.
Of course.
But managing success with addiction, I know that the schools were doing some programming, right? And I think those were well received. I think those are, some of them are ongoing. The pressure that is being put on our children to be successful, right? And to reach certain guidelines. So that's still ongoing. I'd love support from anyone else that would want to do that, but right now, Andrew and I and one other person in town will get some dates on the calendar, but it's probably gonna be spring.
For a presentation kind of thing, a
Yeah,
program.
exactly, a program, 2 or 3 hours in the morning, 9 to 11, something like that, that we'll hold maybe in the library or someplace where we have breakfast and just talk about the impact of everything that's going on, right? And the tsunami that's getting ready to hit some people that aren't fixing it, and addiction to stress for professionals as well.
Right.
Thank you, Russ. All right, so the opioid settlement. Let me see, third week in September. We're asked by finance department, who's taken in the settlement money of $80,000 she reached out and the CFO to see where do you want to use this money? And she reached out to every department. So in terms of human services, I thought it was a crucial department to health and human services, we can bundle it all together. These were the remediation, after talking to Lauren Patterson from the Community Foundation, Paul Reinhardt from New Canaan Parent Support Group, dealing with addiction, as well as Todd Lampert, who was here last. So putting it together and reading the guidelines for remediation under the opioid settlement case, this is what we have come up with. When I say we, New Canaan Community Foundation and Silver Hill sent me their looking through the remediation uses, what they came up with as a possible means of using the money.
Yeah.
So this number 4, support McCain community-wide behavioral health needs assessment, that was, submitted by Silver Hill and the foundation with this, after we had our meetings together.
It's really most comprehensive.
It's really, yeah, they're.
Look, I have to say, I know this was sent out ahead of time, and I don't, in the interest of time, I know we have a speaker and everything. I thought it was excellent, well done.
This is for, yeah, so this is for the commission. This is, Paris and I just spoke about it. All these things are possibilities.
What do we need to
What's the
decide?
timing,
Part-
What would we need to say?
So we had to have this.
It was supposed to be
September
like
30th.
3 days,
Yeah,
yeah.
September 30th.
Last week.
So that's why, this is what I submitted.
Sorry, we went around.
This is for you all to see what I submitted, but this was, as Ben said,
I agree with Russ, looks great.
Yeah,
I would like to know a lot more about the assessment. The 4th item.
and exactly, this was really off the press in
Yeah.
terms of they just wanted to get something out into the opioid settlement discussion.
Mhm.
And so this is future,
Mhm.
but this is what was submitted. If anybody else has other ideas, inclusions, police department have put in for Narcan.
Right, but that's covered under some of the.
Yeah, so we had up to 80,000, I thought this was fair.
yeah.
But at the same time, it is, but the commission is involved in this process, which I'm glad, that was the important thing I wanted to get you to
Can
get.
I just clarify, who are you submitting it to?
Finance department, there's a whole commission.
It was already submitted, right?
Right, but I'm
Yes.
saying in town.
It was submitted to finance, and then finance, there is a whole committee of
Okay.
state for this opioid
that's what I wanted to-
settlement
where does it go?
distribution, to make sure that they gave the town 80,000, and now they have to, it's like a deliverable for.
Does it strengthen going to finance that we as a commission voted on this to support this distribution of funds? Or
When it comes time at a certain point, yes, but right now, this is just paperwork that they
But for them, they might need like a vote, so I just
Well,
suggest for formality.
I've told Mia we want to stay involved in it, she's very happy. Water was favorable.
Why don't we just, I propose that we accept or.
Now either it's reflected in the minutes or it's approved by.
Discussion. Discussion.
Before you take a vote, one of the things I'm viewing this is there's $75,000 of cash available
Yeah, we
for
agree on this,
health and
yeah.
human service. We should be the principal recipient of this grant.
Well, Bethany and I both jumped in on the email immediately.
Don't worry about that, it's not. So it's gotta be run differently.
It's just how it's allocated.
It's allocated.
Here's what I propose that that I like that health needs assessment thing, because there's a lot of moving pieces of the Rubik's Cube
Yeah.
that is behavioral health in this town. There was no accident that Newtown was down here as one of the more behavioral oriented, mental health oriented communities in the state, trying to learn from our urgent care and the things that Bethany does to serve that purpose. Net is that I would propose that we set up a separate group to take a look at. $25,000 is not enough to do a good private assessment of what's going on. But we've now got fundamentally 2 years of working with this network of people that you and Lauren and Waveney and et cetera, you all put together. We ought to see how that's working and why.
So
Use it as a model for not only Newtown, but the rest of the state, because as far as I can tell, we are way ahead of anybody else.
So Jim, can we incorporate that into a motion? So I will make a motion that we approve the distribution of monies that is on the sheet. And that for the community-wide behavioral health needs assessment, that we look at the distribution of those funds specifically based upon what the needs are for the community at that time. So items 1, 2, and 3 will stay as a direct distribution, and item 4 can come back to the commission for distribution.
Yeah.
That's the motion I would make.
And I,
His
I
second.
support that. Second,
Second favor.
Right.
Yeah, and on that, I would assume or hope that we get to approve the survey, obviously, too.
To be a part of it, we'll
Oh,
definitely.
yeah, well, we should
Yeah.
see
So the
that.
thing is,
No, absolutely.
I submitted on Friday.
No, I know, you were under a very.
Sunday night, I get this email from Lauren. Is it too late? I go, never too late, but I see something like this, so I resubmitted on Monday.
No, thank you for that.
Yeah.
So,
So
Lauren's been talking about that for a long time, trying to better survey, better data.
and Lauren came up with the behavioral health assessment, we have the Herzberg assessment. So, yeah. I see it. Well, and you guys, you see.
I will certainly thank Lee on putting a group together.
It's,
from the commission.
Silverville, Lauren, and
Somebody have
somebody else.
volunteer.
Absolutely, thank you.
Yeah, but it's a huge falling.
Like 40 people.
Yeah, I mean, they get everybody who's in.
Julia, we did get some grant money, brigade last year, and Elder House is an agency outside of Buchanan, but very well needed, given other services. So we just wanted to, and having come and speak to us and just sit down.
welcome.
Well, these are all the questions.
I'm Jenna,
Nice to meet you.
Thank you for coming.
No, I so appreciate you having me. Okay, great, and the opportunity. Hi.
And it's a long week.
You're on the screen, you're on the screen.
You never know with Zoom, right?
All right, so Julia, you've been in the position for
February.
February, okay. So this is,
Yeah.
yeah, so
Yeah, so I really appreciate being here, and just a little bit about me and my transition. So my name is Julia Schwartzleeper, and I came to Elder House in February of this year. Took over for Denise Cesario, was there for 30 years. So this has been a big transition. However, this has been my career for many years. And we say that I've had the same mission professionally my whole career, which is to support people as they age, to stay in their communities, in the place of their own choice, and to support caregivers. So that's been my mission in different shapes and forms. I ran a big program in Rockland County for Meals on Wheels, a transportation program, and they had an adult day. Everything I did, they always had an adult day as a component. I worked in Riverdale in the Bronx, and I lived in Byram. So I was really happy to make my way to Connecticut, which was like moving to a foreign country professionally. So I'm very familiar with the services and how to care for the clients, but learning the different names of things and what we call it is a little different. And it's been a big transition for Elder House, coming out of COVID and transitioning to new leadership. It's a really exciting time, but as you probably know, for most people and certainly for nonprofits, this transition out of the pandemic has been a huge challenge. And coming from a transition, we had really, the agency had kind of scaled down to bare minimum. We were only open 4 days a week, and we of course had a lot less clients, but we are now, so I feel like in a way, it's like a rebirth and a really exciting time. We are rebuilding, the board is very supportive in terms of me building back the staff, more hours, everybody was working very part-time, and we're open now 5 days a week. So it's an exciting time. Transportation had also scaled down. So it was harder for us to serve the outlying communities, which are so in need. So we're grateful for the partnership. It's a big challenging year. It's the first time I have presented a budget to my board that has a deficit. But the board is very supportive, knowing that, you got to build it back to be able to move forward. And a lot of exciting things are happening in the state of Connecticut. One of the reasons I'm excited to be providing service here is that it is one of the only states that certifies adult day services. And my predecessor and the surrounding programs have really worked hard for that certification. But I could probably back up, because maybe not all of you know what adult day services are. You know, and that's my biggest thing, is trying to educate people about this option. So we are both a medical and a social model adult day, which means we mostly care for people who have some cognitive loss, but we also care for people who just physically need support. So as you probably know, if somebody needs support as they get older, if they have some illness, whether it's cognitive or physical, you would look to get some help. And you probably know that home care is incredibly expensive, and there's a shortage of workers, and we underpay workers, and all these issues around home care. And also social isolation during COVID, we certainly saw how detrimental that was. So adult day is this wonderful answer to many of those issues, in that we bring people together in this very homey, non-medical kind of environment, but where we provide the supervision and support that they need. But the focus, we have a nurse there, we have social workers there, we bring podiatrists in, but the focus is on having fun and socializing, the ability, best of your ability. We have all kinds of, and this is something, you know, since the pandemic, we're just bringing back in, there's all kinds of community groups that come and visit us. We have a garden club from, is it New Canaan Garden Club? Yeah, yeah, who come in and do, these amazing arrangements, and they just set it up.
Just flowers? It's an organization.
Well, we do have an organization that donates flowers.
Oh, okay.
Yes,
Okay,
that's
that's
probably what you're thinking of. But this is, they bring flower arrangements in, and they bring pots, and like, they just came yesterday, I think it was, and brought things for, you know, like Halloween in the fall. They set it up so that anyone could do it. But yet, you know, I don't have any flower arranging skills, so they right, they are teaching, you know, how to arrange a bouquet, but if someone is not able to, they can still have this experience, and they have something to take home, which is also really important, because it's hard to communicate to the caregivers often what we're doing. My assistant, whose father-in-law used to come to Elder House, she said the joke was he would come home and they would ask him what he had for lunch that day, and he would always say chicken. So they finally called up and said, "Are you serving chicken every single day?" But so not always the best reporters, but what we do hear caregivers say is that you know, their loved one comes home, is happy, is calm, sleep better. And if you've ever had to care for somebody who has dementia, you know, the agitation, the lack of sleep, and being a caregiver is a big challenge. You know, I've been in this field for a lot of years, but then my mother had Alzheimer's and lived with me for a while. And you know, just a totally different experience. So you know, I really believe in what we do. It's something very specialized, but a lot of people don't even know that it exists. And we, you know, our goal is to support caregivers and help them to be able to live their lives, but also to be able to keep their loved ones at home. So, you know, the caregiver is very much our customer, our client as well. And often we have the caregivers who will come in, and we'll interview them with their loved one and say, well, let's let them stay here for a couple of hours. You stay for half an hour, see how it goes, and then you can leave for a few hours. And when we tell them they can leave, they often just weep at the idea that I can go to the grocery store by myself, or get my nails done, or, you know, just sit outside and take a walk. So, you know, that's what feeds all of us in this work that we do. And, you know, the really biggest challenge is to get the word out to people. I was just at, you know, Norwalk has kind of a hub, a resource hub. We were talking about how people don't have the language to ask for what they, you know, if you're not in this field, you don't know what the options are. So it's really, important that, and I really look to all of you to help us to get the word out in New Canaan. So we've had, our numbers are small. We serve about 60 people. Individuals, some come 2 days a week, some come 5 days a week, but mostly it's a very intensive service. So this year we've served 5 people from New Canaan. And that's, and they've been there for 212 days, full days of service where, again, we also brought back our hairdresser, which may sound like a frivolous thing, but for some people, taking someone to the hairdresser is a traumatic thing. We also do showering. Because again, sometimes people with dementia can be, or just physically who need help, we have a lot of men in the program, some big men, and then we have their wives or, they may be older themselves and have physical frailties and assisting the showering and stuff like that's really hard. So we have a separate beautiful room. And if you haven't been to Elder House, I just invite you to come because I have worked at many adult days and many nonprofits, and this is the most beautiful place.
It's unbelievable. I have to say, going there, you just walk in and you're like, oh my gosh, I'm gonna stay here. But
Yeah, I've been there too. It's so
Yeah.
comfortable. And you walk in the coffee and everybody's having their coffee and donuts and you want to sit down and just have.
yeah, it's
fun.
incredible. It's normal.
From the town green.
Still at the park.
Yeah, by the town green, it's behind the church, so the church, it's their property, but we own the building. So, we're really lucky to have that relationship, however, people don't see it, we're trying to figure out a way to put, a sign maybe.
It is hidden, yeah, but
And don't use Google Maps to find it, because you, Maps knows exactly where it is, but oh my God.
I remember that. I remember I was going for a site visit from the community foundation and
Yes.
whoever I was with, we were in the wrong street and we were a little late, but it was, and they had great art. I remember you had really great art stuff and a library and just a lot of resources.
Yeah, we do have a lot of arts programs and it's just, we have different rooms, and as we grow bigger and I'm hiring more staff, we're able to, do different things with different people, because we have people with physical frailty who, cognitively, we need to challenge them and give them opportunities, to work and grow and find purpose. People, often we have people who come in and have volunteer opportunities so they can help, whether it's serving something or help somebody else. We had a gentleman who came in and came up to the staff and said, there was something broken in the bathroom, and he was describing what kind of tools you need, and like not to assume because somebody has short-term memory loss that they don't have skills and experiences, and so the staff was surprised. I was like, why? He probably, takes things in his house all the time, and he didn't forget how to do that. So we really try to respect and work with people's skills and not frustrate them. And I always like to say that some people don't know the difference between a senior center, and so some people will try to bring people to senior centers. And if you have cognitive loss, even if you have hearing loss, a senior center can be a very overwhelming place to be. And it's not a safe place to leave someone who is confused. Some of our clients are extremely well dressed, extremely articulate. I have had people walk right out and hail a cab and go off somewhere. Give the address to an old apartment they used to live in. And, so, we have to be, we have alarm doors, and it doesn't feel that way when you come in, but we have to be aware. I had clients say to me just the other day, I'm just gonna go, out and outside and, going to the bathroom, like the bathroom isn't, outside. You have to, you have to pay attention in a respectful way, those kinds of things. So we very much, I feel like we have scaled down, so we very much want to reach out more to the surrounding communities. And
How big were you prior to the pandemic, and do you intend to get back to that level or even bigger?
we do. So, we have, around 20-something people a day. Sometimes it's like Fridays, we just started to open, so we only have like 12 people during that day. we can have as much as 40 people a day. And when I see the statistics on how many people there are who are in need of service. Also, there was a law passed recently in Connecticut about adult day services, instructing the Department of Social Services to be referring to, adult day. So it's a really great opportunity because of the shortage of home health aides, the understanding of social isolation, and the, state association.
If somebody across the street lives there, how do they get to Elder House?
So, we do have transportation, but one of the challenges we've had, which is why the partnership here with Get About has been really helpful, and at the moment, we still have people from New Canaan, but we're not using Get About, just because sometimes families like to bring their loved one themselves. We have more and more people, whether they're children or whether they're spouses who are retired, right? Because, you know, we have a lot of people in their nineties,
Right.
so their children, even in their seventies, may be retired. So we have, you know, and some, especially at the beginning, we usually do have encourage people if they can bring them, because sometimes the buses. But Get About has been a great, partnership. And one of the things I've done since I've been here is work with the surrounding towns in all of the resources. Norwalk Transit, which, no, you're probably aware has gone through a lot of transitions, but we've kind of revitalized our relationship with them because we used to work really closely with them. And they provide transport, because we can't keep, even if we used to have more buses, but we still have two, and we have two drivers, but we can't be everywhere at once. We can't keep people on the bus too long. So we do it all on a very individual basis. And we're getting a new bus, you know, we get buses from the federal government and, but I don't know, we ordered it a year ago or.
Yeah, ordering these and then getting it, specified.
By 88, yeah.
They say we'll get it next August.
Yeah.
I have a question, what's the fee and is some of it underwritten, how does that work?
Yeah, so we just raised our fees slightly, which was like, you know, one of the things I'm trying to do, which is $110 a day. For lunch, transportation, everything.
How many hours you said?
It's 7 hours. And we really try to discourage half days because the transition is difficult for the other clients. But also if people come a full week, then it's $95 a day. So it goes down depending on how many days a week. So about half of our clients do receive Medicaid through SWACA. So they have the fee covered. We also now just established a relationship with the VA, and you probably read the VA is trying to increase services to older people. And we're trying to educate people that they don't even know that, like adult day is something that can be paid for through the VA. So we just got that up and running. We now have a couple of people from the VA. And sometimes the VA will pay for one day, you know, we patch together. But a big part of most of our clients get some subsidy. So they may be paying $50 a day or $25 a day. The Alzheimer's Association gives us, you know, where it's a little bit here, a little bit there. I mean, I've run different organizations. This one is run by a little bit of support from many different places, but we don't turn anyone down. You know, we try to make it work for people, however we can. Because when people come to us and.
SWAC is challenging, so SWAC and payments, so as much help as we can provide and support you for going and getting additional funds for SWAC. I think those rates are very poor. So yeah, it's a great program and certainly should be supported for sure.
Well, I so appreciate that. I did tell you that, again, with the state push, there has been some support. We did just get a small increase from our SWACA fee. And when I told my bookkeeper that we got this increase, she said, okay, but we won't see it for like 2 years. And we saw it right away. So I'm like, you know what? It's always a new day. And so that was encouraging. And we do, you know, I'm just amazed. It's a lot of work to keep up with all these different, you know, funding. I used to get funding from New York City. I worked for years. I thought that was a lot of work, but they were like 6-year grants. And, you know, it wasn't like every year you have to, so there are a lot of challenges, but, you know, we really appreciate your acknowledgement and,
Absolutely.
Yeah.
No, we enjoyed, it's having someone from the organization itself is wonderful to meet face to face. So we thank you for coming.
Yeah.
today.
you know, like, so we don't pay a lot, we don't have a lot of money to pay for fancy, but we also find people just throw things out, so. We did create this, brochure, I guess, a while ago about our partnership with Get About. And we so appreciate Get About, because a lot of transportation services, like, one in Stanford, only go to medical appointments.
So that's what happened, yeah, so that's what I did when the town took over the Get About. We had some things changed so that the medical, since you had nursing there, we were able to, then. That's what we had. Yes.
Because I didn't get about started because to get someone to hair appointments. I didn't think it was originated from a medical appointment, right?
It's just the regularity of
Yeah.
what we do, although
Yeah.
honestly, for transportation, it's easier for them too, because we have schedules of appointments.
Yeah.
Because let me tell you, transportation, it's
It's a
like,
headache, yeah.
I ran, you know, as much as 12 buses at a time. It is so difficult with drivers, shortage of
Yeah.
drivers and repairs and getting
Yeah.
buses, so, but it's so
Scheduling.
important. You know, I mean, if people can get out, then, so that's why we also try to bring as many services to Elder House as possible.
Yeah.
Yeah.
Great.
Julia,
Thank you.
Thank you so much, Julia.
I can use them, I can bring them over to Lowell.
yeah,
Stay put, yeah, we can.
Yeah.
So
Right.
we
Now
don't.
I feel bad
we're
taking it.
also working with, that all the, you know, staying, in.
Aging in place, yeah,
Organization. I worked for a while for, Bronxville, organization, Brampton Village. Yeah, so, I love the organization.
Yeah.
I helped start One and Rye and, yeah, so we all have to work together because none of us have enough resources.
I have a quick question. One time there were a lot of people on your board. This was like 4 or 5 years ago from New Canaan. Do you have any New Canaanites on the board now?
No, that's a good question, that, no, but we would love to. No, but I really mean that, because we have 2 open seats on the board, so we would love, seriously love to have. So do let me know if you have someone like me, we would love that.
Thank you.
Thank you.
Thanks so much.
Thanks for coming.
Thank you, thank you for your support.
Yeah.
Nice to meet you.
We need to adjourn, right?
Gallery opens during the week.
Yes, Wednesday through Saturday, 10 to 3, Sunday. Oh, you got it. We have over 180.
I make a motion to adjourn.
Oh, very good.
Second.
Oh, yeah. All in favor?
Aye.
I,
Bye, Alicia.
I.